Okay, looks like we are live. Been a minute. I think my sound is good. Okay. All right, so I want to jump on to answer some questions, check in. I've been traveling a whole bunch, haven't been online live in a while, so I wanted to do this to connect with some people, answer some questions, try to help some people out. So we're going to try to do that today. Looks like I might be a little bit glitchy though. Just a little bit. What's up, Cash? Tell me, brother, am I glitchy? I think I'm pretty glitchy. Just figuring some of the dynamics out here real quick. Let me see. I think I'm okay. Yeah, let me know. A little. Okay. I appreciate that. I think it's stabilizing now. Ahmad, what's up, brother? Thank you, brother. Hope you're doing well as well. Hope you're doing well as well. Hope you're doing well. Anyways, so I've been traveling a whole bunch. You don't know, I'm Canadian. I was gone from Canada. And I was in Amsterdam. I was in Tokyo. Now I'm back home. So I do want to start going live a little bit more now that I'm stationary, have the time. So I'm here to answer the questions that everyone wants answered. So if you're struggling with back pain or sciatica, as you can see, the title of the conversation today will be answering questions. So yeah, so if you're struggling with that, let me know so that I can actually answer your questions and help you out a little bit. That's the goal for today. I don't know how long I'm going to go on for, but like I said, I want to do this more often. So what's up, Michael? What's going on? So if you have questions, just drop them in the chat. And I will I'll do my best to answer. Let's go, brother. I love it, Ahmad. Let's get those exercises in, man. Keep the movement going, right? Get those positive inputs. I love that. Hello, Jennifer. So, lower back pain, go to feet, need to know how to start exercise. So what I'm guessing you're saying is that you have lower back pain and you have shooting pains down to your feet. That's what I'm guessing. Tell me if that's completely off, but when you're in that state, likely have a lot of nerve irritation, and it's not necessarily a set of exercises that you want to start with, but I have a free program and 6 exercises that can help you. But more than anything, the thing that people are missing when they have this type of back pain isn't the exercise or the fix. It's actually the stuff that they're doing every day as the first part. So you want to start to deal with, okay, what are the things that I'm doing every single day that are continuing to keep me in pain? And on the other side of it, you want to start to think about, okay, what are the things that I can do to build my body up so that I can be more but be a better mover and have more capacity to move without instigating pain, right? So I always like to think about like lower back pain. Um, if you have sciatic pain specifically, if you have like a cast, so if you have like a broken arm, usually they'll cast your arm, right? They'll put a caster on it, and they do that so you don't move around a whole bunch and hurt it. Well, with your back, you can't do that. You can't put a cast on it. And to be fair, like you don't want to be just lying around in bed, like resting, because what will happen is if you do that, you'll also run into a whole bunch of effects. Because sure, your arm, right? If you put your arm in a cast, all that muscle, everyone who's ever done that, your muscle gets smaller, right? There's that atrophy. Well, imagine if you do that for your entire core area and your entire lower legs. Your muscles are going to get even more atrophy, right? And that's going to be a big time problem for the long term. So, one side, what do I do to stay moving but not instigate pain and keep hurting it? So, put it in a cast, so to speak. Well, avoid those bad movements, but then still move enough that I don't completely atrophy and like kill all my blood flow and everything like that. Okay. But I do have a free program. I'll send it to you. Just comment uh, rebuild and I'll send you that program. So you can comment or you can DM me rebuild and I'll send you the program. Cash, brother. Okay, yeah. So I know you lift heavy, brother. Um, yeah, if you're doing a row bent over like that in that position, 3 or 4 plates, you're a beast. Right leg has shooting pains. I mean, it could be. So like, just to be clear, sciatica um, is a term that gets thrown around, but what that really is typically it's because of some sort of stimulation on the sciatic nerve where the nerve is like overreacting, right? So the sensations that you get is because of some stimulus, physical stimulus on the nerve, and it's like firing like crazy. So yeah, that could be sciatica, but sciatica is just a stimulation of that nerve. So does it goes down your leg? Is it down the back of your leg? So the sciatic nerve runs down typically the back, so into the glute, down the back of the leg, down into the calf. So if that's the case, there's definitely some stimulation happening. Whether it's full blown sciatica, typically that's like a thing that happens all the time. It's not just like an acute an acute thing. But what I will say to you, brother, is I'd be really cautious about continuing to lift that way. If you continue to push your body that way, you can run into some serious problems where that it's not just sticking around when you're lifting. It's not just only when you're lifting. It'll be like all the time, right? And that's kind of the people that I help every single day that are now stuck in this pain all the time, right? And we don't want that. So honestly, man, I would truly modify the way you're doing some of those lifts, uh, so that you're not causing that sensation. If that makes sense. Jennifer, you're gonna want to DM me rebuild. So just DM me rebuild. That way I can send it to you. Because if I leave the chat, um, then I won't see it. Um, Rockstar Hair God herniated L4 L5 S1 hairstylist. Yeah, I'm sorry to hear that. People who are on their feet a lot, slightly bent forward. That's a tough position to be in. Cash, send me a DM, brother. I'll send you some stuff to really focus on some of your core bracing and your core stability. That'll give you a bit more capacity so that you can actually get back to lifting heavy. But there's a few things that you can do to kind of shore that up. So send me a DM and I'll give you some info. We can chat a little bit, okay? Um, yeah, just got 2 lower back injections to get me through the holiday season. Oh, I'm sorry to hear that, Rockstar. I'm hoping that those injections bring you some good relief at least, and I'm hoping that you get some time off. So, one thing that you want to know about getting injections is that they definitely can work, and so I hope these have given you some relief. But they sometimes are a false sense because what happens is you start being like, "Oh, I'm okay," and then you move a whole bunch, um, and what happens? What happens when you move a whole bunch? If you're, again, moving in those ranges of motion that are instigating what used to be the pain, but you can't feel it anymore, you're making it worse and worse. And I see people who get injections, and then after 6 weeks or whatever, 3 months sometimes, it'll wear off, and then they're just in the same amount of pain or more. So just be really cautious, and just know that like you haven't fixed anything, even if you feel better, okay? But I hope that you have gotten some release. Um, awesome, Rockstar Hair God. Jump into the program. It's really gonna help you, inform you on this stuff, okay? Yoga Jade, nice chatting with you. Yeah, it was nice chatting today. Absolutely, thanks for your time. So thoughts on inversion tables. So okay, so inversion tables is essentially what the same question Jennifer asked. How do I feel about spinal decompression? So for those who don't know, inversion tables one where you hang upside down and your back is decompressing. I used to have one. Um, what I prefer is that if people are going to do decompression, that they do a manual decompression that they're controlling, because when you have control, your body's more likely to relax and you can control how much tension you're giving. Okay, now that said, some people are going to do decompression and it's just going to make it worse. So depending on what exactly is going on with your specific situation, if you do decompression, it can make it worse. So just know that. However, it can also make it better when combined with other interventions, right? So you don't want to just do decompression and be like, okay, I'm good to go, right? You want to combine that. If it does feel good, you want to combine that with some stability and some high quality movements that are strength based, endurance based, and focus on stability. If you can combine those two, likelihood is that you can kind of like keep the results of the decompression. Because at the end of the day, you got to train yourself to move right. There's no point in getting decompression and then just having it get all done because you haven't actually addressed anything, right? So this is super important to make sure you do that. So yeah. So and again, Rockstar Hair God, you got the program, so jump into that. And yeah, Yoga Jade, I think it's like, and Jennifer Parsons, it really is one of those things where it can be hit and miss. And I think it has at some point it's not going to work anymore. So I talk to a lot of people, they say the first time they went for decompression it felt good, and then after that it stopped feeling good, right? So it's like one of those things, sometimes it just like feels good one time and then it releases some tension, but then after that it never works again. So uh G Bena 30, I have severe case of spinal stenosis. I'm sorry to hear that, man. Again, what how do you feel, brother? And that's the big thing. So spinal stenosis is essentially like a narrowing of the spinal canal, and people get it as we age. It's something that we get, and there are things you can do for it, but it definitely is tough. But there's always things you can do to fortify the body. So I'm curious, Gina, how much pain do you have? That's the big thing. Curious about. So apparently my volume is quite low. Um, so I hope you guys got your phones up super loud, because I don't have my fancy equipment right now. I'm just using my normal volume. So apologies. I know I heard someone tell me that they couldn't hear me, but when I checked the volume on my end, it seems fine. So let me know. Okay, GB, tingling on my right leg and feet. Man, that's super tough. How often do you get that? Like, is it consistent, or is it during certain activities? Do you wake up with it? Is it the moment you start walking? Very curious. and calf pain. Yeah, that's pretty standard. But tell me a little bit more about when you start to feel it. Volume was good. Thanks, Cash. Sounds good to me. Yeah, thanks, brother. Yeah, some people. I'm actually broadcasting on YouTube as well. That was a YouTube comment. So good to hear that it's all good on Instagram. I'm not sure why it's not good on YouTube. Okay, okay, that's great. That Gbina, that's great. So you wake up with it, and it goes away with movement. So that's awesome. What types of things are you doing to actually to manage it? Are you doing anything? Um, Jennifer Parsons, feel pulling calf and tingling in feet. Yeah, that's super tough. That's very very common. What type of stuff are you doing right now to deal with it? Okay, I have spinal stenosis and I have a pinch in my pelvic that leads down to my kneecap and on my foot. Yeah, I'm sorry to hear that. Sounds like you're dealing with it. So just the thing, like, um, I want to answer people's question. I want to help them, right? So if you're here and you're like, oh man, I want to share. Ask me a question because like the question, I can actually give you guidance. But if you just tell me how you're feeling, that can't help you, right? Um, I could say a hundred different things, but without a specific question. Like it'd be like if I said, just gave you like generic information about me and never asked a question. You'd be like, okay, cool, man. So I want to help you guys out. I want to, if you have a question, just ask it, um, and then we'll go from there. Ah, damn. So how come you haven't done it yet, or do you have a surgery scheduled? Or are you thinking that you don't want to get the surgery? I guess that's the other big question. All right. Okay, so I want to make this a quick one. If there's no questions, I'm going to jump off. But if you do want my free program, uh, just comment rebuild, and I'm going to send you that program, okay? It's a good program, get you started on that path to recovery, starting to address some of these issues, how to sleep, how to move, what types of training you should do. And it's a great place to start uh, to, uh, to build up the body and get things going, okay? I'm out of here. Appreciate it. Send me a DM if you have any questions. I will answer you.